Welcome to The Explainer. Today, we're diving into a topic that affects literally millions of us, yet it's so frequently misunderstood. I'm talking about continuous positive airway pressure therapy, or as you probably know it, CPAP. If you've ever struggled with sleep, woke up feeling completely exhausted, or found yourself fighting with a bulky machine at 2 in the morning, well, you're in exactly the right place. We're going to completely demystify CPAP therapy today and hopefully unlock the secret to some truly life-changing rest. Okay, let's just quickly look at our roadmap for today. First, we'll cover the simple science of CPAP. Then, surviving the first few weeks, the true power of consistency, some alternatives and exceptions, and finally, we'll wrap up with your frequently asked questions. Let's get right into it. Section 1. The simple science of CPAP. So let's totally strip away the clinical jargon and that initial intimidation factor right from the jump. What exactly is CPAP? Basically, continuous positive airway pressure is a treatment that uses steady air pressure to keep your airway open while you sleep. It's just a machine, a tube, and a mask delivering a constant, gentle flow of air. And this basic mechanic is absolutely crucial. Why? Because airway collapse is the #1 reason people with sleep apnea snore, gasp for air, or wake up feeling like they haven't slept at all. By keeping that throat perfectly open, CPAP literally prevents those dangerous nighttime breathing pauses. Now, there's usually a pretty stark contrast between what new patients think is going to happen and how the treatment actually works. A lot of people picture this complicated, almost scary ventilator that's somehow, forcing you to breathe. But the reality? It's incredibly simple and honestly a lot more comforting. It's really just pressurized air acting as a gentle splint. It just holds the airway open so it can't collapse on itself. It doesn't force air into your lungs at all. It simply removes the blockage that was messing up your breathing in the first place. Section 2. Surviving the first few weeks. Look, if you're feeling anxious about starting, that is entirely valid. When you kick off this journey, here's the totally honest version of what you can expect. First up, you'll have a thorough review of your sleep study results. Next comes the mask fitting, and finally, a short at-home adjustment period. These 3 milestones, they are exactly what everyone goes through. And I really want to reassure you right now, almost all patients need time to get used to wearing a mask and sleeping with pressurized air. Please hear me on this. Needing time to adapt is absolutely normal. It is definitely not a sign of failure. I know those first few nights can be genuinely tough. I mean, common early issues usually include dry mouth, maybe some mask discomfort or minor skin irritation, and honestly, just the feeling that the airflow is strange or even a bit claustrophobic. It kind of feels weird, right? It can be cumbersome for sure. But here's the great news. These uncomfortable realities, they are almost always fixable. Changing the mask style, tweaking the fit, or just having your clinician adjust the pressure or humidification settings usually knocks these problems right out. So why do we focus so heavily on getting through these initial hurdles? Well, long-term studies show that your early compliance patterns strongly predict whether you'll actually stay on therapy years down the line. Basically, how your first few weeks go shapes your entire 5-year outcome. This is exactly why getting clear setup guidance and fast follow-up from your provider early on is a huge priority. You don't have to just tough it out or give up in silence. Section 3. The power of consistency. Let's look at a rather shocking reality in the medical world for a second. A 2021 systematic review found that CPAP adherence rates commonly sit right around 50%. Yeah, 50% adhere to the therapy, and 50% just abandon it completely. That means roughly half of prescribed patients aren't using their machine enough to actually get the benefits. And it's usually not because the treatment failed them biologically, it's simply because the nightly habit never fully formed. To make sure you end up on the winning side of that statistic, you really want to avoid a few common mistakes. First, please don't expect it to feel perfect on night 1. It takes time. Second, avoid using it inconsistently. It's not some occasional tool for when you feel extra tired. It has to be a nightly routine. And third, never wait too long to report discomfort to your doctor. Small issues, like a poor mask seal causing air leaks or a dry mouth, are incredibly easy to fix if you just mention them early rather than enduring them for weeks on end. The whole point here is the massive payoff that comes from making CPAP a genuine, consistent nightly routine. The benefits are literally life-changing. We're talking about significantly less daytime sleepiness, much sharper concentration, fewer morning headaches, and vastly better overall energy. Plus, there are massive safety benefits. Because untreated sleep apnea severely impacts your alertness and reaction time, getting effective, consistent treatment actually meaningfully reduces your driving risks. It's a total game changer. Section 4. Alternatives and exceptions. Now, while CPAP is definitely the most common and widely studied treatment out there, knowing your alternatives leads to much better, more informed conversations with your doctor. For instance, there's oral appliance therapy. This repositions the jaw and is generally best for mild to moderate obstructive sleep apnea. Then there's positional therapy for folks whose apnea is specifically worse on their back. This basically just encourages side or stomach sleeping. Weight management can also reduce tissue around the airway for cases linked to excess weight. And finally, surgery is an option to address specific anatomical structural blockages.
However, it is vital to understand that CPAP is absolutely not a one-size-fits-all solution. In fact, it can actually be dangerous for certain specific groups. This includes people with a poor respiratory drive who just aren't breathing well on their own, folks with unstable cardiorespiratory status, anyone with recent facial trauma or surgery, people with certain lung conditions like a pneumothorax, or those with severe anxiety who are completely unable to tolerate a mask despite support. This is exactly why a proper professional sleep evaluation is strictly mandatory before any treatment begins.
Section 5, Frequently Asked Questions. Let's get into it. First up in our FAQs, what should truck drivers expect before a Department of Transportation exam? Well, the great news is that most drivers absolutely keep their certification once their therapy is properly underway. The key strategy here? Start early. You want to build a solid track record of usage data so the medical examiner can check it directly. Get that data ready. Don't get caught in a stressful last-minute scramble the week before your exam. Next up, a totally critical one for the bed partners out there. Honestly, this is the key to saving a lot of relationships. Will CPAP actually stop the snoring or just make it a little quieter? I can confidently reassure you that for most people, the loud snoring stops almost completely once that airway stays open. Sure, there might be a little bit of quiet machine noise left over, but it's nothing like before. Most partners notice a massive, peaceful difference within the very first week. Okay, what about travel? Can frequent travelers realistically stay consistent? Absolutely yes. Travel size machines make this incredibly easy these days. The real risk isn't the trip itself. It's making the deadly mistake of skipping nights just because packing your main home machine felt like too much of a hassle. Having dedicated travel gear totally removes that excuse, so you can stay consistent on the road. Now, what if you already tried CPAP once in the past and quit? Is it worth trying again? The answer is an emphatic, enthusiastic yes. I highly encourage you to give it another shot. Most people who quit simply had the wrong mask or maybe the wrong pressure setting. It wasn't the treatment itself failing them. A simple refit or a quick pressure change often completely fixes the exact complaints that made you quit in the first place. It is absolutely worth one more try with the right clinical support.
Here's a really important clinical question. How does CPAP work if you also have a heart condition? Actually, it works the exact same way for everyone. Steady air keeps your airway open all night long. But this is especially vital for heart patients. Why? Because those nighttime breathing pauses put a dangerous amount of extra strain on the cardiovascular system. Stopping those pauses directly helps protect your heart. Before we wrap up, here is a super brief but absolutely crucial maintenance tip for your long-term success. Keep your gear clean. You really need to replace your mask cushions and tubing roughly every 3 to 6 months. Worn-out parts are a huge, often totally overlooked cause of air leaks and skin irritation. Don't make the mistake of assuming the treatment itself is failing when it's really just old, leaking equipment. We have covered a lot of ground today in this explainer, but I want to leave you with this final, powerful thought. Strip away all the clinical language, ignore the plastic tubing, and just remember this. Consistent nightly use is what turns this from a machine into real, measurable rest. So what will your first step be toward a better night's sleep? Because when you consider that we literally spend a third of our lives asleep, isn't it time we stop treating rest as a luxury and start treating it as the absolute foundation of our health? Thanks so much for joining me today.